So, um, last month in Katani Hospital, Katani, Kenya, it was about 9:30, 10 o'clock at night. We see a mother with an arm in her chair running across the fields of Katani. Katani's sort of like a prairie, it's flatland. And so on her way to the hospital, she's jumping fences, jumping barbed wires. She is just running at the top of her abilities, and she has a baby in her arm who has stopped breathing or nearly stopped breathing from asthma attack. She comes rushing into the emergency room, and immediately we saw what was happening with the child, and we did several simple things. One is we opened the airway, we applied some oxygen, applied a little stimulation, started a nebulizer treatment, and within minutes, a child that was lifeless was restored to life. That child went on, spent several hours with us that night, and eventually would be admitted for overnight observation. Today, the child, she was about, I guess, 1.5, 2 years old, a young child. Today, that child's growing and living and thriving. All but for Katani Hospital being there in the community, all but for it being there, that child today would be dead. We have so many, we have a stone quarry near us, and many workers become injured in moving large amounts of stone with 5-ton, 10-ton, 20-ton trucks. It's not unusual. People get run over, people fall off the trucks, they break their arms, they break their legs, they crush their pelvises. In the past, those workers would be permanently injured and maimed, but instead they throw them in the back of a truck and bring them to us. We're able to stabilize these patients. We're able to work with local hospitals like Kenyatta Hospital and Nairobi, work with hospitals to get a specialist like an orthopedist to then come in, repair them, and they come back a month or two later. A couple months later, the worker comes back and thanks us for saving their lives and getting them into the hands of the specialists they needed in order to fix their fractures and get back to work. And so this story is repeated hundreds and thousands of times each month at Katani Hospital in Katani, Kenya, where patients come in who would have died in the past. Because when you come into Katani, we don't check your pocketbook first. We don't check to see how much money you have in your pocket first. We save your life, we stabilize you, and then we talk about some reasonable payment later. Yes. We even have patients who go home. We discharge them to home. They bring their money back to pay us. And so, yes, we're going to treat you. We're going to save your life. We're going to stabilize you. We're going to make you well. And then we're going to talk about financial compensation, to help us keep the lights on and pay the bills for our staff and everybody, so that the next patient that comes in will also have supplies and services.
Can you do the story one more time about the child that had that meningitis?
Yes. Yes. Last month, when I was in Kenya, we had a 2-year-old child that was brought to us in clinic in the emergency room, who was a full-term baby to spontaneous vaginal delivery, full-term, normal APGARs. At the age of 2, developed spinal meningitis and developed scarring of the brain, damage to the brain, and began seizing. And the child would seize 1 to 5 times most days. And the child's now 9 years old and has been seizing for over 8 years, 7 to 8 years. And so what we did initially is we examined the child, and while examining the child has a seizure. Grand mal seizure, tonic-clonic grand mal seizure. Okay, shaking head to toe. And then becomes postictal. We looked at the medications that the child was on, and we believed that the medications that he'd been on for a while were not sufficient, not adequate, not enough to control his seizures. And so what we did is we worked with the pediatric department at Johns Hopkins. We made a decision about the medications that are available in Kenya, and we changed the child's medicine. We got the child's seizures under control, so the child became seizure-free and slept for about a day. We then changed the medicines, all medicines available in Kenya. We changed the medication to a medication regimen that now has that child virtually seizure-free. The child's now been seizure-free and is starting to feed himself, starting to walk, starting to talk. They're looking at putting them into school. And the child has a life, and equally important is that the family has a life. Because prior to this, the entire family was devoted to protecting this child and providing the child with what the child needed to not get hurt when they had all these seizures. So now the child has a life and is looking to school. The family and the mother and the grandmother, who were totally chained to this child, taking care of this child's needs every day, now have a life. And the rest of the family, the community that they live in, which is some distance actually from Katani Hospital, the entire community now has a life as a result of making these medicine changes and providing the child with a different approach to treating the seizures, which here in America is quite common, but is not so well known in Kenya, although our hospital is in the process of training other Kenyan physicians about how to approach these very complex seizures.
That's awesome. That's the Katani Hospital Project. I'm going to put the web address on there so they can contact you and Modesta for more information. But those are fantastic stories of people in everyday life that are coming into that hospital. They're getting medical care, and you guys are saving lives. That's fantastic.
Yes, it is. It's very exciting. There is no greater reward, and it's the thing I love to do, the thing Modesta Fassander and I love to do. We've been practicing together for 20 years. Is our most favorite thing is not interviews and it's not raising funds. It's touching patients and saving lives. There is just no greater reward, and we believe it's the gift that God gave us. There is no greater reward than to be able to touch a patient and heal that patient so that that patient has a new life. And the possibilities of these patients is endless. In fact, when we talk to political leaders from the African nations, we talk to them about the greatest resource they have is not their mahogany and not their gold and not their oil and not their silver. It's their people. The greatest resource they have are the people of the African nations.
That's awesome.